As y'all know, it is Gyal Dem Wednesday, and on Gyal Dem Wednesday, we pay special attention and highlight the Gyal Dem. And of course, anyone is aware that we have a global pandemic happening at the moment called COVID-19. But not what everyone doesn't know is there is an increased risk for women and young girls during this period of time. And I'll explain to you why. Often, when you have situations of gender-based violence, these are the moments that they spike for obvious reasons. Partners are at home for longer, partners are frustrated, and often that culminates into big pressures that end up exploding in the home. On top of that, when you look at communities where there's high levels of abuse, specifically abuse on young girls, these are the moments that they happen. So there are specific issues that are specifically related to young girls during this COVID period. So it is Gyal Dem Wednesday. We wanted to highlight some of them, and we have a brilliant conversation that we're going to be having right now with the wonderful Gemma Parkin. Gemma Parkin works for ActionAid, which is a women's rights organization working not only in Kenya and around the world as well. And these organizations are really important because many of you tuned in wouldn't have even taken time to realize that there are specific issues for women during this period of time. And maybe this will just pique your interest a little bit and make you aware of the fact that young women, young girls have a significantly different risk posed on them than maybe our young men in the society. Hello, Gemma. Welcome to the show. How are you?
I'm all right. Thank you. Thanks for having me.
Thank you so much for coming. So we like to keep it 100. So let's just dive straight into the questions. Which issues would you say women specifically are going through during this quarantine and during this COVID period? Because I think a lot of people would say, look, it's bad for everyone. What's specific about the issues facing women and young girls?
So many. So ActionAid is an organisation that's all about women's rights, and we're responding to the coronavirus emergency because this is absolutely a women's issue. So health workers, the majority of them are women, nurses. So they're actually on the front line. They're most likely to catch coronavirus, unfortunately. And we know about the issue with supplies of masks and gloves. So they're the ones that are going to be getting it at work if they're working in the health system. They're also the ones that are most likely to be looking after the children at home when the schools are shut. So they're the carers, they're the health workers, and then they're also most likely running the home, because we know that the kind of burden of all of the domestic chores always end up on women's shoulders too. And so when you've got people then in a family setting, we find unfortunately that domestic violence goes up, because people are worried about their next meal. They don't know whether they're going to have a job tomorrow. They don't know how to put food on the table. And it's incredibly stressful. And not that that's defending violence against women, but you do find that domestic violence goes up. And so we're extremely concerned about those women. Loads of factors to make this a women's emergency.
And also in communities where conversations around sexual abuse are not brought to the fore, and you have more people, like you said, who are at home in local communities, unable to leave. I'm so sure young girls who are victims and survivors of domestic abuse are either right there experiencing it significantly more, or with constant reminders of maybe a perpetrator in their environment much more than they would have been beforehand.
Yeah, you're totally right. It's a horrific reality, isn't it? Because if you imagine that if you're being abused at home and school used to be your escape, or work used to be escape, then you can't get away from the perpetrator perhaps. And it's very hard to make that phone call to the police or whoever you need to kind of get through to access help. So it's a terrible concern. And also, people living in kind of overcrowded conditions are also just going to be more at risk of kind of coronavirus, and the fact that everybody's telling you to, wash your hands, but there's not necessarily running water. There's kind of loads of factors that this lockdown, causes for many reasons. It's obviously necessary, but it's not an easy solution.
When we're talking specifically about domestic abuse happening in the household, I think there are some people who don't necessarily know so much about domestic abuse and some of the psychological stuff that goes with it. And the argument, I guess, for someone who's less informed might be, well, you know, these are women who are going through domestic abuse anyway. What has coronavirus and COVID-19 got to do with a spike in domestic violence? But we've seen across the world, hospitals, many healthcare workers saying that along with COVID-19, we're seeing horrific attacks. We're seeing stabbings. We're seeing, in some cases, women who are close to death. Women who otherwise maybe would have been experiencing domestic violence, but not on the level that we're seeing now. What is kind of the psychological cycle surrounding that at the moment?
Yeah, you're right. It's a horrible truth that it happens anyway, but certainly everybody is kind of tracking that there has been a spike, and it happens during all emergencies. Women and girls become targets of abuse during emergencies. So it could be anything from, you know, like a food crisis, a drought, cyclones. Women and girls always end up bearing the brunt of the kind of stress that it causes. They end up having to adopt new kind of practices in order to get money to buy food. So then you have kind of increases in you know, sexual abuse and like selling sex for food, and all of these kinds of things always happen in emergencies anyway. But what we're finding, and along with lots of kind of commentators like the UN, is that the spike in violence around coronavirus is probably along economic lines.
Yeah.
So the fact that everybody has lost their jobs and has lost their income and don't know how to kind of feed their children, it just puts such a pressure on the family that, you know, families are pushed to breaking point, and it's women that suffer the most.
Not only do women suffer the most in this, and I think like what you're saying about the economic stance, there must also be a connection between the education disparity, because of course you have a lot of young women who have less access to education than young men do, so maybe aren't even able to vocalize, especially in lower economic communities, what's happening to them, be aware of even why this particular situation is causing this rise. Is there a connection between education disparity and maybe a response to the heightened risk of domestic violence in the home?
Yeah, I mean, it's a really good point, isn't it? Because information has been such a crucial factor in responding to this crisis, especially in the rural areas, like you say. So whether or not, you know, your kind of, you know, understanding of what the definition of violence is, and you know who to go to, that's kind of one level of it. But, you know, even at a basic level, it's actually really hard to inform people about how they can protect themselves during a crisis. If you can't have any meetings at a community level and you're under lockdown and you can't go out and do the humanitarian response programs that NGOs would normally be doing. I mean, that's why we rely on the radio to try and get the message out there. So we really appreciate shows like yours that are raising awareness. But we kind of go around communities in rural areas like with a megaphone, and we try and share information that way. As well as kind of providing water, and we haven't been providing food directly because there's obviously a case of transferring the virus. But what we do is we give cash transfers via M-Pesa, and so that means that we send it straight to women, because women run the households and they will spend it on their children, and so that's the best way to run a kind of a charity program is identify the women who are the kind of leaders in the community, and you funnel the aid donations through them. That's the way we operate at ActionAid anyway, and it works very well for us and for the women that we serve.
Amazing. I think there must be a lot of young men. I mean, I've done quite a lot of awareness raising conversations about specifically gender-based violence and the spike that has been global, especially during this period of time. And the feedback I always get from the young men is, look, we don't support this, we're not with this, we don't like it. How do we get involved in the conversation? So how can we get the young men out there involved in the support of young women who might be going through some of the issues that we've spoken about, be it gender-based violence, be it sexual exploitation, be it the need to sell sex for food at this moment? Like, how do we get young men more vocal?
Yeah, it's brilliant that they're talking about it, and they should continue to share those stories on social media, talk about it to not just people that agree with them, but to people that don't agree. That's the key, isn't it? So that we're not all just talking in our kind of echo chambers of people that agree with us. Keep spreading the word online and call it out when you see it.
Yeah.
And offer an ear of kind of support to anybody that you think might be in trouble. But we do need those male spokespeople as well to support the cause. This isn't just an issue that targets women and can be solved by women. You need men
community
to be on. Exactly.
Thank you so much, Gemma. I'm sure the Vibes Nation tuning in will have got loads of words of information and encouragement through that. And if anyone who is tuned in might be experiencing cases of domestic abuse, might be struggling right now, what are the ActionAid contact details so that they can reach out to you directly?
Well, we have a lot of information on actionaid.org.uk, and that's where you can find out more and donate to our emergency appeal if you'd like. Thank you so much.
Thank you so much, Gemma. Thank you. I really appreciate it. Like Gemma said, if you're a young man tuned in, the conversation does not stop at the women's level. We need our young men to speak on behalf and to support our sisters. We need our young men to be talking out against their brothers who are behaving in a way that is just completely inappropriate. Hospitals right now are overrun, and I'm not over exaggerating. I was with a doctor the other day. Overrun with women right now presenting with heightened cases of domestic related abuse. So please, together as community, together as Kenyans, we can stop this. Keep it vibes, do not touch.